when the arterial pressure remains consistently higher. It's called hypertension or high blood pressure. There are many myths related to hypertension, and today we are going to bust all those myths. Hi, this is Dr. Parag Sanghvi, founder Be Your Force. Today we are going to talk about the common myths related to hypertension and the actual facts. About 26% of the global population is suffering from hypertension, and this is expected to go to 29% by the year 2025. Myth number 1, hypertension runs in my family, so I too will develop hypertension. Hypertension is known to run in families. However, if we make proper lifestyle changes, exercise regularly, keep a watch on our intake of salt, maintain our weight, we can avoid developing hypertension. Another related myth: no one in my family has hypertension, so I will not have hypertension. Family history is just one of the factors for developing hypertension. Other factors like obesity, stress, other medical conditions, lack of physical activity, these all factors can develop hypertension. Myth number 3, I don't take table salt, so I'm in control of my sodium intake and hence I won't develop hypertension. It's true that controlling table salt is useful in avoiding hypertension. However, 75% of our salt comes from processed food. Simple processed food like tomato soup, condiments, pre-mixed food, preservatives, they all have sodium. So be careful when you are buying this type of foods. Watch out for labels which says soda or sodium or Na. All this means that there is an extra sodium content in those foods. Another myth: I am fine, I do not have any signs or symptoms, so I cannot have hypertension. Do you know that hypertension is known as the silent killer? Half of the population who has hypertension have no signs or symptoms of hypertension. I had a friend of mine who was fit and fine. He wanted to start running, so he got his health checkup. During the health checkup, they found that he had hypertension. My friend just refused to believe it. It took a while to convince him that he indeed had hypertension and he had to be put on medication. Myth number 5, only doctors can measure the blood pressure as it requires expertise. This was true in the olden days, but nowadays with the advent of digital BP, that is blood pressure measuring instrument, you can buy an instrument and measure your blood pressure at your home. You need to keep one thing in mind. If you're measuring in the morning, measure it in the morning every time. If you're measuring it in the evening, measure it in the evening every time. Another myth which is very common is, now my blood pressure is normal, I can stop the medication. Never do that. If you stop your medication on your own, there will be a rebound increase in your blood pressure and all the consequences of high blood pressure will be there. Do not take this drastic step, and if you ever think of stopping your medication, please consult your doctor and then do the needful. This is Dr. Parag Sanghvi, founder Be Your Force, signing off. Thank you.